Hi, my name is Andrew Finlinson. I'm a student of physical therapy under the direction of Dr. Clausen. Today we're going to be talking about a patient case regarding muscle contraction using electrical stimulation. So a couple of indications for the reason why we're going to do this. So the patient that we have, he just sustained an ACL reconstruction about 2 weeks ago and he's having an extension lag. So he's not able to get that extension that he needs out of his leg. With the electrical stimulation, we're going to be able to help reteach those nerves to fire and get that quad firing again. A couple of things we're going to check before we do that, just some contraindications and precautions. First off, we're going to look at the wound and the scar to see if that's healing properly. If that's not healing right, we're going to try to avoid this. Also, we're going to check for some different sensation issues or things like that around the area, and just different circulatory issues as well. But yeah, so we'll go get to that. So Josh, you're the patient today. How are you doing?
Good, how are you?
Good. How has it been since the reconstruction?
It's been good. Just the problem getting my knee completely straight, but other than that, I've been good.
Coming along, I guess. That's good. Okay, well, let's check this scar out. It looks like it's healing up all right. You haven't noticed any crazy bleeding or different kind of stuff going on with that, have you? Okay, good. And then, are you able to feel these different spots and things right around here?
Yes.
And no sensation issues?
No.
Okay. And have you had any circulation issues or blood clots or anything like that around the area?
No.
No? Okay, awesome. Perfect. So, Josh, what we'd like to do with you today is some electrical stimulation. All that is we're going to use this machine right here, and we'll place a couple electrodes just right here on your thigh, and that will help to reteach the muscle to contract. So right now, as you're able to tell, you're not able to get that leg fully extended all the way. And so this will help kind of reteach the muscle to contract again. Is that all right if we do that with you?
Yeah.
Okay, perfect. So we'll just take this. I'm going to try to get this around a good chunk of the muscle here. Thanks for rolling up your pant leg for me. That helped a lot. Okay, so what we're going to be doing over here is we're going to set it up with a biphasic type of contractions pattern. We're going to use a pattern of a 10 and 50 ratio, which means that it's going to be contracting for 10 seconds and then relaxing for 50 seconds, just to allow for the muscle to get the energy back and to relax for a little bit. And we're going to set the ramp to about 1.5, so that it's a gradual increase for the contraction that's going to come. Since we want to reteach the muscle to contract, we're going to have the pulse rate set between 50 and 80, and for him we're going to set it at 50, and the pulse duration we want for muscle contraction, we want it at 200 to 800, so we're going to leave this right around 200 for him. And then what we're going to want to do with the intensity, we want the intensity to be up as high as he can tolerate, and it should be around 60 to 70% of his maximum voluntary contraction of his quad. And then we're going to go for about 10 minutes there because we want about 20 contractions total. So we're going to do that. So Josh, before we go and before I turn this on, what you should expect to feel, it's going to contract your muscle for you. We want it to be strong as you can tolerate, but not to like a painful, excruciating level kind of thing, okay? So you will feel, it might be a little bit uncomfortable, but we do want that strength there to be able to reteach the muscle to contract, all right?
Okay.
Okay, so I'm going to gradually turn this up, and then you tell me when it's strong and tolerable for at least 10 minutes, okay?
Okay.
I guess first just tell me when you start to feel a little bit of a contraction there.
Feel it tingling now.
Okay. So we're going to keep going there, and then you let me know when to stop.
That's probably good.
Okay. And when you feel that contraction, we're going to want you to try to contract that leg as well with it.
Okay.
Okay, just like that. Is it feeling all right?
Yeah, I'm feeling it contract now.
Okay. So after about 10 seconds, oof, there you go, you see that?
Yeah.
So we'll let it just relax for the 50 seconds, just like how it said here. It's just gonna contract for about 10, relax for 50. Was that too uncomfortable or anything like that for you?
No, it was fine.
Okay, perfect. So we'll leave it there then. You'll just have about 9 minutes left, so it should contract just a few times more. And then once we get that done, we'll go to your exercises, all right?
Yeah, sounds
And if
good.
at any point you do need to adjust it, if it's too strong or if you do feel like it's a little bit weak, we can just adjust that for you.
Okay.
Okay, perfect. So we'll just have another contraction here in just a little bit. Are you in a comfortable position there, or do you
Yeah.
need me to?
No, this is
adjust
good.
something? Okay. Let's leave that. There it goes. Okay, contract that quad as much as you can. Good. And hold that there. Okay, awesome. Okay. So you made it through your contractions. How did that turn out?
It was good. It was powerful, but wasn't painful.
You made it through. Okay. Looks like things are still good here. As far as skin goes, did you notice any other discomfort or anything that we should know about from that?
No.
Okay, awesome. Well, we'll get you going on some other exercises if there isn't anything else.
Nope, sounds good.
Okay.